Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. This segment around, we have Dr. Kurt Garren. He is with us to talk about sinusitis. Now, you are an ear, nose, and throat specialist. What is sinusitis? It sounds like it's a sinus infection.
Yeah, well, I mean, quite frankly, that's all that it is. Sinusitis is just basically inflammation of your sinuses. And you know what most of us experience are the acute sinus infections. You see your doctor, they put you on some antibiotics, and you feel better.
Do you have to have antibiotics? Can you just blow your nose for 10 days and be over it?
Well, you know, a lot of times that's what most people do because the majority of sinus infections are actually viral in nature, even related to allergies, and don't require antibiotics. It's usually after about 7 days that we realize that it's probably becoming more bacterial, and we actually lean towards treating it with antibiotics.
And when do you decide that it's really severe enough for another kind of treatment?
Well, in general, after people start to have maybe 3, 4, 5, 6 in a year even, which is not uncommon around our Tuscarawas County and our valley here, or if people start to have kind of ongoing symptoms, the facial pain pressure, the chronic nasal discharge, the headaches, if they start having that for ongoing more than about 3 months, then we determine it's more likely to be chronic and we have to get a little bit more aggressive.
So the medications, do they become just more potent? Or when do you decide you need to do something else?
Well, and when we get to that point, we're usually dealing with a little bit different types of bacteria. We have to use more aggressive, more potent antibiotics. We have to use them for longer terms, longer courses. So instead of the usual 7, 10 days, you might even see your doctor giving you 3, 4, even up to 6 weeks of antibiotics. We get to that point, we also add in intranasal steroids, intranasal antihistamines, different medications you spray in your nose to try and decrease the swelling and inflammation of your nose to help the sinuses drain. If it gets bad enough, we'll even start to see people using oral steroids to try and get rid of the swelling inside the nose.
That's all it is like an inflammation of your sinus cavity.
Correct. And when it gets to that point, it's usually caused by bacteria that cause the swelling. And actually the sinuses have specific areas in which they drain through, holes in which they drain through, and that's what they're supposed to do. And when they get inflamed, they swell shut. And as they swell shut, that fluid that isn't able to drain that your body produces throughout the day gets infected.
Oh, that sounds awful. And can you do surgery for it?
Yeah, if people have had ongoing problems, if they've tried the intranasal steroids, the oral steroids, most of these people at this point have probably been allergy tests to see if there's an allergy component to it. And if they've been treated with appropriate antibiotics, appropriate medication, they continue to have problems at that point, oftentimes we'll do a CT scan. Actually, probably all the time we'll do a CT scan. And if we see some evidence of chronic thickening of the sinuses on the CAT scan, then at that point we'll discuss with them, possibility of surgical intervention to try and treat and control their disease.
And what do you do during surgery? Do you remove part of the sinuses, the lining, so that it opens up a little more?
In the olden days, what we used to do is we would go in, and this is many years ago, predating even my foray into medicine. They would actually go in and just kind of pop in the sinus and rinse them out and hope. And then we got a little bit better and we were able to use endoscopes, so we can go in and actually directly look at it. And then we did start to remove tissue. We would take down part of the tissue, trying to open up the sinuses. In this day and age, over the last about 5 to 6 years, we've significantly improved our techniques. We're now using what we call balloon dilatation. It's based on the old cardiac catheterization. We take a balloon, we put them into the affected sinus, we get it into the actual natural opening of the sinus, and we dilate it up. By doing so, we actually remove the tissue and open up the sinus. Because it's mostly bone, it outfractures, and when it does that, it heals open to create a larger passageway so that chronic inflammation will no longer exist because the fluid will be able to drain out of it.
That sounds painful. So you kind of break their nose open and it stays open.
Well, surprisingly, with these newer techniques, there's minimal pain involved. In fact, most people undergoing that type of surgery are getting back to work within a couple of days afterwards, and even to the point now where we're doing these in the office under a local anesthetic with the patient awake and not sedated, and they're going home the same day and returning to work even the next day.
And how long does it last?
Well, indefinite. I mean, at this point, because you're not really removing any tissue, you're just opening it up to be natural, you're returning it the way it was supposed to be. If it heals the way we want it to and the way it's supposed to, it should last pretty much forever.
Now, what about those over-the-counter nasal strips that you put on the outside of your nose and opens, are those any good? Or?
In some people they work fantastic. If the obstruction, the issues are on the outside and it's actually where your cartilage are collapsing on the outside, they will work for a lot of those people. In general, most of the people that we're talking about, the issues are internally inside the nose and they need a little bit more aggressive approach.
And then what if you know, can't decide what to do and you try meds? How long do you go? Like, you were talking 12 weeks or 52 weeks?
A lot of it depends on the response that the patients have from the medication. If they're getting a little bit of response, we'll give it a little bit longer. If they're not, and they have good evidence of chronic sinusitis symptoms, have been treated appropriately in the past, and have the CT scan evidence that there is some disease process, then we're more likely to get aggressive. Particularly now in this day and age when it's a lot less invasive procedure. People are going back to work. Unfortunately, in the past, the way we used to do it, these people would undergo surgeries and they would wake up and they'd have packing in their nose. They were miserably uncomfortable. It was unbearable. The packing stayed in for about a week or so. Then it had to come out in the office. It was uncomfortable. It really deterred a lot of people from having a necessary procedure that would really improve their quality of life. With the
so they can actually breathe.
Correct. With the newer technology, with the balloons, we can go in, open up sinuses, get things to drain out, make them feel better. They're feeling better, and within 2-3 days, they're pretty much back to normal. Rarely do they even require analgesics, oral pain medicines.
Wow. Now, do you just go to your primary care physician and they can do it, or do they need to refer you to a specialist like you?
In general, these are only performed by specialists. In fact, the newer technology while it's readily available, has not been adopted by all surgeons. There's only a handful of us in the entire Northeast Ohio region that's actually doing these. And as far as locally, as of right now, I'm the only one that's been trained to do them in the office.
And a lot of people only want the procedure if insurance will cover it. Is this a old enough procedure that insurance companies like it yet?
It certainly is. I mean, it's already been approved by the FDA. It's been done for actually about 7 years commercially available. I've been doing about 6.5 years myself. With all the time that they did with the research and things developing this, it's been around for about 10, 12 years. All this really is a different way to open up sinuses than what we used to do. So as far as the insurance companies are concerned, it's no different than any other intraoperative surgical procedure. And in fact, it's so widely accepted that they created special codes to make sure we got paid for doing them in the office. So there's no issues with insurance companies.
And are there any particular patients that, you know as soon as they walk in the door that, oh, you're a balloon patient, let's take care of that, or do you try everyone on medication first?
In general, everybody gets tried on medications first. I mean, when we get into surgical, intervention, while I am a surgeon, we do enjoy that. I mean, you really have to make that the last resort, particularly when a good number of patients will resolve and their symptoms will improve with, the conservative medical management, allergy therapy if they have allergies. So, this is usually reserved for people who are kind of the last case scenario. They've tried everything else. They're still having symptoms. They, they present to the office. They have the typical facial pain, pressure, chronic nasal drainage, headaches, little visual changes, even teeth pain, and the nasal obstruction. They're just kind of miserable, and they're like, hey, enough's enough. And they show up, and we work them up, do the CAT scans, and we look at them and say, hey, you know what? It's time. It's time to get some relief for you.
Yeah, it's a lot of patience of, being patient where, okay, how much can I possibly take?
Right, and a lot of that is dictated because of the definitions we have, and for it to be chronic, it has to be at least 12 weeks. So unfortunately, patients suffer for a little bit being treated with antibiotics before they usually get to, proceed forward with surgery if they need it.
All right, very good information from Dr. Kurt Garren from Dover. Thanks for being on Medical Minutes.
Well, thank you.